Well, a fitting segue from biomarker research is going to be a presentation on nutraceuticals, which is essentially oral joint supplements. This will be from Dr. Kochak's colleague, also from Colorado State University. Dr. Wayne McIlwraith is the University Chair of Orthopaedics and Orthopedic Research Center. Please welcome Dr. Wayne McIlwraith. Good to see you again.
Good to see you. Thank you, Donna, and thanks for the invitation to speak here. I've only missed one of these and echo Tim Parkin's comment about how important the summits are and how useful they've been. I think that, as far as I know, this is a new topic to have at the summit, and I wasn't quite sure when Jamie said this was on the schedule, but I think on reflection, just some disclosures, they're in such common usage now that I think it's appropriate to do a review of them. Osteoarthritis is the single most common lameness in horses, the most common cause of lameness. Horse population in the US is estimated to be 7.3 million, and therefore there's a lot of horses that potentially have this debilitating condition. It's similarly important in humans, affecting at least 20 million Americans, with incidence expected to double over the next 2 decades. So this has led to large usage of these oral joint supplements, is what I want to call them at the moment, in both humans and in horses, well, in other animals as well, because they're a common choice and they're perceived as a benign treatment for OA in horses, and they are indeed a benign treatment if you don't count what they do to your wallet. There's a high prevalence of OA combined with the lack of a definitive cure has probably contributed to the popularity of oral joint supplements. One of the situations in human is because of priorities of companies, a little bit in the same way that Chris had talked about. Osteoarthritis doesn't get many new treatments coming along, and that's a combination of how much money the companies can make and also the regulations of the FDA who make it very non-conducive to doing research on or spending the money on. And of course, we also know in the equine industry, the side effects of non-steroidal anti-inflammatory drugs and corticosteroids are an argument. They've been given a lot of publicity. Not all of it's true, but people are very much aware of that. And of course, oral joint supplements come across as something that's pretty benign. So just going to review the stages of OA in a joint, and this is a series of diagrams that I made, starting with the normal joint and having an image, sort of an arthroscopic drawing, as well as a histologic picture. I see they're fading out a little on the screen, but we start off with synovitis, inflammation in the synovial membrane and joint capsule, which is a very common day-to-day problem in the equine athlete, particularly the racehorse. You haven't got any morphologic damage to the cartilage, but then you go through stage 2 and stage 3, and you start getting some change in the cartilage, superficial fibrillation associated with the mediators that are produced by the inflamed synovial membrane, causing degradation on your in the articular cartilage. And of course, at stage 4, you've got chronic inflammation, you've got stiffening in the joint capsule, and you've got full thickness loss of articular cartilage, which severely compromises the horse. Now, there'll be no test on this and no questions, but this is a diagram I made years ago, but to make the point that there's a cascade of events that come from synovial membrane, but not just synovial membrane, also come from the bone below, the subchondral bone immediately below the cartilage, that causes degradation of the essential components of the articular cartilage. And these are really critical to the long-term health of the horse. So the goals of all of our treatments in traumatic joint entities are to return the joint to normal as quickly as possible, prevent the occurrence, to reduce the severity, or at least prevent OA if you can. In other words, reduce pain and minimize progression of joint deterioration. And that's divided up into symptom-modifying osteoarthritic drugs as well as disease-modifying osteoarthritic drugs. And these are terms we've borrowed from human rheumatology. Now, also the timely removal of osteochondral fragments, fixation of larger fractures, appropriate treatment of OCD, these are all critical to the reduction of osteoarthritis as well. To most people, owners and trainers at least, fixing them surgically is the priority, but what we're really doing is preventing the long-term development of osteoarthritis as best as we can. So we evaluate effectiveness on 2 criteria, and this is where it gets the symptom-modifying effects, disease-modifying effects. Now, the symptom-modifying effects, we can evaluate the effects with reduction in lameness, reduction in reaction to joint flexion, decrease in synovial effusion. Disease-modifying effects are a lot more difficult, and so we need to prove that we're actually decreasing disease in the articular cartilage, that slow, insidious problem that develops with degradation of our components. And so at CSU, at the Orthopaedic Research Center, we've evaluated all these treatments using an OA fragment model. We can develop a very consistent level of osteoarthritis, and in this fashion we can see with data what our results are with these various medications. Now, I'm going to focus today obviously on oral joint supplements, but the point being is that this is the only way that we can really quantitate the disease-modifying effect of the drugs. So that's why we use models, or we've used this model a lot for evaluating various medications. Nutraceuticals, back to where we were before, where do they fit in? They're not usually prescribed specifically by a veterinarian, and that's a bit of a problem because there's no specific diagnosis. It's very common to have a horse presented with osteoarthritis or with at least lameness associated with the joint, and they've had a period of treatment with nutraceuticals, and it's only when they haven't responded that the horse comes. They're a common choice of clients, and for reasons I said before, that's understandable, because they're perceived as a benign treatment for OA in horses. So as far as the critical components, well, they're divided up into type 2 collagen, which is a very specific collagen for articular cartilage, and it's like the framework in the joint, and then proteoglycans, which aggregating proteoglycans is now known as aggrecan, and that provides the compressive strength. Water is an important component as well. It's the water trapment by the proteoglycans that gives you the strength. There's a high prevalence of OA in combination with a lack of definitive cure that's probably contributed to the popularity that I mentioned before. These are the most popular types of nutritional supplements for horses. It's estimated that 49% of all horse owners these are from Packaged Facts, use them. Indications, there's 2 main indications that, I shouldn't say indications, so there's 2 purposes that people choose to feed their horses oral joint supplements. One is to treat lame horses and make chronically unsound horses sound. And of course, this is my comment here, that this use is somewhat flawed because often the source of lameness is never diagnosed when the owner or trainer elects to use supplements without consulting a veterinarian. The other use is to prevent, delay the development of joint problems. Now, this is hard to prove, but also hard to disprove. And the same goes for the use of products like intramuscular Adequan, intravenous hyaluronan, where it's very difficult to prove that you're actually going to improve joint health and decrease the likelihood or decrease the onset of osteoarthritis in the working athlete. So it's always been a challenge, and of course, but because you can never prove that it doesn't have an effect, it's led to a lot of market use of this, and not just oral joint supplements. The same goes for, as I mentioned before, intramuscular Adequan, intravenous HA. Most common usage for those products is quote-unquote prophylactically. So this diagram's got obviously hard to read, but Just there's various processes that, in theory at least, these joint supplements could be useful. So the majority of the oral joint supplements, certainly at the start of all this and the start of their use, included glucosamine and chondroitin sulfate, along with other added ingredients. And these ingredients include manganese, vitamin C, hyaluronic acid, or HA, polyunsaturated fatty acids, rare earth minerals, unsaponified avocado soy, a real mixture, green-lipped mussel, that's misspelled there, acetyl myristoleate, and then what we're going to talk about each of those individually, because there is certain evidence and non-evidence for those. I'm not going to talk about MSM or various herbs just because we haven't got documentation. So we're going to talk about what we know and what's been scientifically shown with these products. And the problem, which I've already inferred, is that marketing with little control is an issue. Now, the FDA have had some surveillance over some of these products where they've stopped people saying that you're going to treat osteoarthritis. That's why in most of the advertisements now you see that they promote joint health. They're allowed to say that. Now, obviously, these products are not, they don't have to be licensed. And so they fit within nutritional supplements, same in humans. And so there's no incentive really for the companies to provide too much in vivo proof. However, there are some associations that have developed that are monitoring it a lot more closely. And that's raised the bar in the fact that the companies have been challenged. The one that's principal one, and I didn't get this on the slides, I just realized later, is the National Animal Supplement Council that actually have a database that's very large on the various amounts of different substances that are in these supplements. And so there is an improving situation. So some people got FDA letters, as I said, but if you talk about just joint formula and promoting joint health, then that's okay. So none of the oral supplements or oral nutraceuticals, as I mentioned, are licensed, but let's just go through some brief history with these, and most of them started with the essential components being glucosamine or chondroitin sulfate. The initial product was, there was a chondroitin sulfate product made from bovine trachea. There was also a complex of GAGs and other nutrients were recognized in the New Zealand green-lipped mussel, and that was a product called Sinoflex. Cosequin was sort of the first big-name product that came out. It was a combination of glucosamine, chondroitin sulfate, manganese, and vitamin C. The latter two would promote the effect of the others. And there's been a number of products that have simulated Cosequin. So these products, a lot of them have been tested in vitro, and people have shown what they inhibit in vitro. In other words, in usually cartilage explants or cell cultures, showing that they would decrease the amount of deleterious enzymes or protect against the effects of interleukin-1, which we feel is the main bad guy at the top of the cascade in osteoarthritis. So this was a study that Julie Decant, one of our residents at the time, did at CSU with Gary Baxter on looking at the effects. The trouble is, what is it like after it goes through the gastrointestinal tract? And that's one of the big questions with oral nutraceuticals. Now, there's an investigator, Dr. Wendy Pearson at the University of Guelph, who's developed a technique of pre-digesting these products and then testing in vitro. So in other words, simulating them having gone through the gastrointestinal tract of the horse. And I think that's quite novel because obviously we're never going to get good in vivo studies done on all the products, but at least it could be useful as a screening tool. Back to glucosamine and chondroitin sulfate, as I said, it works in vitro. And then, of course, the next studies that were done to try and solve the problem of what about after they're absorbed, there were two significant studies or groups working on this, and they showed that chondroitin sulfate, yes, it gets absorbed in sufficient concentrations in the joint to have an effect. On the other hand, the evidence is with glucosamine that you don't get absorption in sufficient levels. And this work was done out of Sheila Laverty's lab in Montreal. It still doesn't prove effectiveness, but at least it gives you some inclination. One thing that I should comment, Chris Kalchak just reviewed all the biomarker material, and this is an important one because a lot of people have evaluated effectiveness with these products by measuring them in the blood. And ironically, there's a contradictory situation in that serum GAG levels, or glycosaminoglycan levels, of which are a big component of nutraceuticals, actually get increased with osteoarthritis. We use them as a biomarker of OA. It was one of the markers we used in that study in California. HA levels in humans have been well recognized as a biomarker of rheumatoid arthritis in people. In other words, your HA levels in the blood go up when you have that inflammation. So that's no way to test them. So therefore, clinical trials are certainly the gold standard, and they're difficult to do. This is a review that Wendy Pearson, who I mentioned before, did of 15 in vivo equine studies. They looked at all the in vivo studies, and the authors signaled an encouraging trend. These were Dr. Pearson's conclusions. Manufacturers of these products are interested in research. As I said, the bar is getting raised as far as what people do. But overall, the level of evidence for in vivo demonstration, in other words, in the horse, in the live horse, demonstration of efficacy is weak. But I will go through some of the studies that have been done. Similar problems in humans. This was the most heralded study done with nutraceuticals. What has been found is that there was a definite positive correlation between effectiveness and who funded the study up till this time. So in other words, companies did the studies, and I'm not implying that they purposefully skewed the results, but there's a problem called bias with all statistical evaluation and study design. So this was studied by this study was funded by the National Institute of Health, and it's been known as the GAIT study, Glucosamine Arthritis Intervention Trial. And what they did, the short story is a lot of patients, and this was published in the New England Journal of Medicine, and basically no significant improvement in knee OA in this study. It was all done in osteoarthritis of the knee, was shown with supplementation with glucosamine and chondroitin sulfate. Has it changed the availability on the shelf? No, I think it's just a sign of how many people have osteoarthritis pain, and they'll try most things. So there's the rest of this talk, just quickly, a few clinical studies that have been done. Sash's blend is a combination of New Zealand green lip mussel, shark cartilage, abalone, and lipid extract from another shellfish. And this study was done, and they showed that it decreased. What they did, it was very interesting. So they fed horses this product orally at the normal dose. They had a control group that got placebo. They then injected IL-1 beta, I mentioned that before, into the joint. This is a model that we've started using. It's all over in 48 hours. It provides this temporary inflammation, and you don't have to euthanize any horses. And they showed that there was decreased PG2 levels, prostaglandin E2, which is a good marker for inflammation in the joint, and so and also GAG levels, which again were a marker of release from the cartilage. Oral HA is a really interesting one because when IV HA came along and we were asked to test it, this was a long time ago, I sort of was puzzled. I said, why would that work? And then when we did the research, injecting the HA in the bloodstream, it did work. And we showed that it was effective in osteoarthritis and quite long term. So this was a paradigm shift when people started telling me about using oral HA out in Kentucky. And actually the first two companies to produce it were both veterinarians, and this is Conquer, that was developed by Dr. Scott Pierce. And this was the first controlled clinical study done that I think was particularly exciting. Basically, these were horses that had surgery, arthroscopic surgery for OCD in the tibiotarsal joint in the hock. They'll often remain having some degree of synovial effusion, always reduced, but a lot of them will have some degree left. And so they divided into two groups. They fed oral HA, and they showed that the treated group had a significant reduction in synovial effusion. This was a double-blinded study in that the observer of the effusion was not aware of the treatment group. And so this was a really positive study showing the value of intra-articular HA. I don't think any of us know why on earth it works, because we always were focused on HA being this big molecule that went in the joint and enhanced lubrication. Well, obviously, it's not a big molecule after it's gone through the GI tract of the horse, but there's a component in there that provides efficacy. Similarly, green lip muscle, there's been a double-blinded placebo-controlled study. This was done in New Zealand and showed a significant reduction in the severity of lameness, reduced joint pain, and improved response to joint flexion. Okay, you're not going to be looking at the cartilage when you do a clinical study, but I think these are really encouraging on how these studies have been done. There's one study being done in the CSU chip fragment model, and this was with Avocado Soy. This company came from France and asked us to do the study, and we were really excited because they were prepared to pay the costs and live with the results. And unfortunately, so anyway, this was what we showed. So we showed not only that we had symptom-modifying effects with this product. This is just a slide showing what we do. We create this fragment arthroscopically, and then we exercise the horses on the treadmill. It's very humane, but we do get an insidious, consistent level. We have 8 horses in each group based on power calculations. And we not only can look at the clinical signs, but we can look at the disease signs. So this is intimal hyperplasia, which is just proliferation of the cells at the surface of the synovial membrane, an index of inflammation significantly reduced. But what was also exciting is that our cartilage disease scores were significantly reduced. In other words, we had disease-modifying effects as well. So significant reduction in the severity of articular cartilage erosion and synovial hemorrhage, significant increase in articular cartilage glycosaminoglycan synthesis. That's what makes up those are what make up the proteoglycans compared to placebo horses. Unfortunately, this company got into problems with the manufacturer of the product that we'd tested, and it's never come to market. In the meantime, other companies have certainly jumped on this, and this is Cosequin ASU that has avocado soy mixed with it. We were a little puzzled as to what avocado soy was going to do, but actually when the company came to us, there was 4 studies done, blind controlled studies done in France. The company was from France, and it's now marketed as a capsule piaslidine in France, and very effective in human osteoarthritis as far as symptom reduction goes. Polyunsaturated fatty acids are probably the newest one. Omega-3 fatty acids have a number of value found in oily fish and fish oils. They decrease the production of a number of components, but what's particularly exciting, and we've shown these are important in the horse, is these enzymes are increased in both the synovial membrane and the articular cartilage of inflamed equine joints. Now, they've got a long name, which we abbreviate to ADAMS TS 4 and 5, but also be known as aggrecanase 1 and 2. For a long time, we thought metalloproteinase is what broke down our proteoglycan. We now know that aggrecanases are the critical enzymes, and they will be inhibited by there's been shown again in vitro that they will markedly inhibit aggrecanase production in cartilage. This is an in vivo study that a grad student of ours, PhD student of ours, did not so long ago. It's been recently published, and we showed that we had lower expression of aggrecanase 1 in inflamed synovial membrane in vivo with the product as well. This has been put into a number of products. Platinum Performance is one example where that's been added to the regimen more lately, and certainly has positive effects. Acetyl myristoyate is another product that has had a controlled study. This was presented at AAP some years ago by Kevin Keaton and showed a significant reduction in AAP lameness scores. They also did a visual analog scale and looking at response deflection. One question that as I said to you at the start of the talk, I wanted to review products that had been shown to be effective scientifically. Platinum Performance started off as a product that was mainly rare earth minerals, lots of rationale because boron, vanadium, cadmium had all been shown to be critical in bone healing. And anecdotally, I feel that they can enhance the speed at which, certainly after fracture fixation in the horse, can heal. OCD pellets is one that gets a lot of publicity. It's a multiple product with HA, silicon dioxide, amino acids, vitamins, etc. And silicone has been shown to increase bone density. But here's the dilemma there, as has been well outlined by Dr. Kauchak. Increased bone density is not necessarily good. Now, I'm not saying that OCD pellets or silicone supplementation is going to cause harm, but we still need to have a better method of equating bone density with bone strength. Most of the aspect that we're excited about with CT and change in bone density is having a differential change in bone density at the fracture edge, which is what Chris showed. So it's still a question, but it may well be very beneficial because we certainly know if the increase in bone density is reflected in an increase in bone strength, then it can be useful. Okay, some other reading. I've summarized all this in a book we've recently put out in a chapter on nutraceuticals in our book, and then also this book on equine nutrition has got a lot of information in it as well. Thank you.
Do you want one? Do you want a question?
Any
Are you good for
questions?
one question?
You, sir.
Okay. It says, where does the utilization of oral MSM to control joint inflammation fit into the OJS?
Yeah, well, I purposefully left it out. I put it at the end of that slide because we don't know. There's a lot of in vitro work, but there hasn't been any in vivo that I'm aware of, and I apologize if there is a paper somewhere, but yeah, we just haven't done any in vivo work. That's why I didn't address it. But no, it's been shown in vitro to have a number of anti-inflammatory effects at the level of those multiple mediators.